Hi, I'm Dr. Littlejohn. I'm a medical oncologist in Dallas. Trastuzumab-deruxtecan is an antibody drug conjugate that's FDA approved for unresectable or metastatic HER2-positive breast cancer and locally advanced or metastatic HER2-positive gastric cancer. It's also used by providers in a number of different HER2-expressing cancers as well. What it is a combination of different drugs, one being trastuzumab, which is a monoclonal antibody directed against the HER2 receptor on cancer cells, and a topoisomerase 1 inhibitor, which is a type of chemotherapy. What happens is that when trastuzumab goes in and binds to the HER2 receptor expressed on cancer cells, the entire molecule is internalized into the cell, and the topoisomerase 1 inhibitor, the chemotherapy payload, if you will, is released into the cell, leading to DNA damage and cell death. This is a really exciting new therapy for these women with breast cancer that's unresectable or metastatic, especially. It's really become the second line preferred therapy for HER2 positive disease after patients have received pertuzumab, trastuzumab, and chemotherapy. The drug is given via an IV infusion every 3 weeks. The first dose is given over 90 minutes, and if patients don't have any severe side effects and they tolerate it well, you can give subsequent doses over 30 minutes. There is a significant chance of nausea with vomiting with this medication, so you do need to pre-medicate them with antiemetics, which is really common for most of the treatments that we give. Most patients, will experience nausea despite these medications, but we have drugs to manage that, as you know. Other common side effects will include vomiting, decreased appetite, fatigue, hair loss, a decrease in white and red blood cell counts and platelet counts, and an increase in liver enzymes. You also need to know about diarrhea, abdominal pain, mouth sores, decreased potassium, cough and cold symptoms, shortness of breath, and fever. The main payload of this drug is a chemotherapy, so those side effects need to be thought of. However, because the chemotherapy is being given directly to the cancer cell and not to every cell in the body, the side effects are somewhat mitigated. Serious toxicity can occur in the form of lung disease, such as ILD or interstitial lung disease and pneumonitis. These manifest as shortness of breath, cough, fever, and patients that experience these need to be promptly evaluated by a provider and often have imaging done with CT scans. In the trials where this drug was studied and approved, there were patients that experienced very severe reactions to this drug from a pulmonary standpoint, and some patients even passed away from it. And so we really need to take this seriously if patients present with respiratory symptoms. Further, cardiac function needs to be monitored prior to getting the medication because trastuzumab, the monoclonal antibody portion of this, has been known to lead to some heart dysfunction. And so an echocardiogram is recommended prior to therapy, and if patients start to develop any signs of congestive heart failure during therapy. Finally, neutropenia is also a severe complication. White blood cells that fight bacterial infections, the neutrophils, can get very low and leave the body very susceptible to bacterial pathogens that can really take hold and really wreck someone pretty quickly. So if patients develop a fever while they're on this therapy, they need to be promptly evaluated, their labs checked, and prompt administration of antibiotics is really important. So trastuzumab-deruxtecan is a really exciting new therapy for these patients with HER2 positive disease. Again, it's FDA approved right now in the breast and the gastric space, but I expect down the line, more approvals will come forward.